Welcome back to the channel. So I was doing a little research on the US and other countries and their healthcare and how much they're spending, et cetera, et cetera, et cetera. Because we have a lot going on right now. Like in New York, they're using supposedly or having an idea of using the National Guard to do certain jobs, especially healthcare. So this led me to this, and the title is The U.S. Healthcare from a Global Perspective 2019. Higher spending, worse outcomes. Worse outcomes, people. Okay, let's get into the article. A 2015 Commonwealth Fund brief showed that before the major provisions of the Affordable Health Care Act were introduced, the United States had worse outcomes. There's that word again. And spent more on healthcare, largely because of greater use of medical technology and higher prices compared to other high-income countries. By benchmarking the performance of the U.S. healthcare system against other countries and updating with the new data as they become available, we can gain important insights into our strengths and weaknesses and help policymakers and delivery system leaders identify areas for improvement. This analysis is the latest in a series of Commonwealth Fund cross-national comparisons that uses health data from the Organization for Economic Cooperation and Development, OECD, to assess the U.S. healthcare system spending, outcomes, risk factors, prevention, utilization, and quality relative to 10 other higher income countries: Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom. Excuse me. We also compare U.S. performance to that of the OECD average, compromising 36 high-income member countries. Highlights: the U.S. spends more on health care as a share of the economy, nearly twice as much as the average OECD country, yet has the lowest life expectancy and the highest suicide rates among the 11 nations. The U.S. spends more on healthcare as a share of the economy, nearly twice as much as the average OECD country, yet has the lowest life expectancy and the highest suicide rates among the 11 nations. The U.S. has the highest chronic disease burden and in obesity rates that is 2 times higher than the OECD average. America had few physicians visits than peers in most countries, which may be related to a low supply of physicians in the U.S. Americans use some expensive technology such as MRIs and specialized procedures such as hip replacements more often than our peers. The U.S. outperforms its peers in terms of preventive measures. It has one of the highest rates of breast cancer screenings among women ages 50 to 69 and the second highest rate of flu vaccinations among people aged 65 and older. Compared to peer nations, the U.S. has among the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. Higher spending and worse outcomes. Nearly twice as much as the average OECD country, yet has the lowest life expectancy and the highest suicide rates among the 11 nations. Has the highest chronic disease burden and obesity rates that is 2 times higher than the OECD average. Have fewer physician visits, expensive technologies, has the highest rates of breast cancer screening among women ages 50 to 69, and the second highest rate of flu vaccinations among people aged 65. The U.S. has the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. This is the article. The Commonwealthfund.org. Commonwealthfund.org. People, we have to trust in ourselves and our ability. We have to fortify our lives. Excuse me. It is so much going on for you to get distracted. If you blink, you will miss it. This article is from January 30th, 2020. So this was last year. Not even a year ago. But it doesn't matter the time. We have to fortify our lives. It's things that's going on right underneath our nose while we are being distracted with stuff that make us dumb. The TV shows. The food is numb and dumbing us down. The politics. Other people's opinion. The divide. The technology. I come here and I make these videos to provoke thought, to get people to thinking, because we need one another. We need to fortify our lives, because the government does not care about us, does not have our best interests. Scroll down, then it's the spending. The U.S. spends more on healthcare than any other country. %16.9%. Wow. The U.S. public spending is similar to other countries. Out of pocket and private spending are higher than most. The public spending, the private spending, and the out of pocket spending. The average U.S. resident paid $1,122 out of pocket for health care, which includes expenses like co-payment for doctor visits and prescription drugs or health insurance deductibles. Only the Swiss pay more. Residents of France and New Zealand pay less than half of what Americans spend. At $4,092 per cap, U.S. private spending is more than 5 times higher than Canada, the second highest spender. The U.S. has the lowest life expectancy. Wow. It's all here. Despite the high spending, Americans experience worse health outcomes than their international peers. For example, life expectancy at birth in the U.S. was 78.6 years in 2017. More than 2 years lower than the OECD average and 5 years lower than Switzerland, which has the longest lifespan. In the U.S., life expectancy masks racial and ethnic disparities. Average life expectancy among non-Hispanic Black Americans, 75.3 years, is 3.5 years lower than for non-Hispanic whites, 78.8 years. Life expectancy for Hispanic Americans is 81.8, is higher than whites and similar to the Netherlands and New Zealand and Canada. Despite the high spending, America's worse health outcomes than their international peers. Here's my thing. How do you know who? How are you determining how long we live? Who's determining how long we live? So this is like a population control thing. It's like 78.6 years. So you cut me off at 78? Like, that's why we have to stay focused. Suicide rates are the highest in the U.S. 13.9%. Reflecting shorter life expectancies, the U.S. has the highest suicide rate of these countries. U.S. adults have the highest chronic disease burden, 28%. Chronic disease burden defined as adults age 18 years and older who ever been told by a doctor that they have two or more of the following chronic conditions: joint pain, arthritis, asthma or chronic lung disease, diabetes, heart disease, including heart attack or hypertension/high blood pressure. Worse health outcomes and shorter life expectancy appear related to risk factors in diabetes and disease burden. More than 1/4 of the U.S. adults report that they have ever been diagnosed with two or more chronic conditions such as asthma, diabetes, heart disease, or hypertension during their life, compared to 22% or less in all other countries. The U.S. has the highest rate of obesity, 40%. Obesity is a key risk factor for chronic conditions such as diabetes, hypertension, and other cardiovascular disease and cancer. The U.S. has the highest obesity rate among the countries studied, 2 times higher than the OECD average and approximately 4 times higher than in Switzerland and Norway. Overall, obesity rates were the highest in English-speaking countries, all with the rates of 1/4 or more of the total population. Issues that contribute to obesity include unhealthy living environments, less regulated food and agriculture industries, and social economic behavior factors. I'm going to read that one more time. Overall, obesity rates were the highest in English-speaking countries, all with the rates of 1/4 or more of the total population. Issues that contribute to obesity include unhealthy living environments, less regulated food and agricultural industries, and socioeconomic and behavior factors. The FDA here does not regulate our food. We're consuming things with synthetic dye, with MSG. Everything that we're pretty much are eating has a slow poison, and it's causing us heart disease, and it's causing us diabetes. The drinks, the sodas, the pops, the juice, all the sugar, the sodium, the water, the lead in the water, the soap we're using, the chemicals on our hair when we dye our hair, the lotion, the perfume, the sunscreening, the suntan lotion you guys put on. Everything. Literally everything. Let's move forward. The utilization. Americans visit the doctor less frequently and have fewer physicians. Despite having the highest level of healthcare spending, Americans have fewer physician visits than their peers in most countries. I'm like just shaking my head. Some of these things are new to me. Some of these things I had already knew. But we have to fortify our lives. We have to find ways to heal ourselves. But my best advice, my first advice, my only advice, the best advice I can ever give anyone is to get on your knees and you can pray. Pray. Pray that by his stripes you'll be healed. You pray. You get on your knees and you pray for the matters of your heart. Ask for forgiveness. Ask for strength and guidance. The U.S. has a high rate of MRI scans, magnetic resonance imaging scans per 1,000 population. We have to pray, y'all. Work on your salvation. Because the country that we're living in, and it's not just this country, it's other countries too. But I'm going to expose and I'm going to talk about where I'm at. The United States of America, the North America, has a higher spending and worse outcomes. It spends more on healthcare, twice the amount as other countries. It has the lowest life expectancy, guys, and the highest suicide rates. The obesity rate is 2 times. They have the highest in chronic disease. Don't have many physicians, doctors. They use the most expensive equipment. The breast cancer rates for women of ages 50 to 69. The second highest rate of flu vaccination among people who are 65 and older. They have the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. We need to fortify our lives. Like, subscribe, leave a comment. I'm out.